Good evening, everyone. It is 7:30 on December 10th, 2013, and as we are approaching the holidays and Christmas, I am so grateful to have some very like-minded physicians on these calls with me. If you are a physician or maybe giving this to a physician to listen to, what I want to really emphasize is how the people in this company truly are like-minded, going towards the same goal at the same time, and I really think it's to help and to serve mankind. I am privileged to have Sveta Silverman on the phone, and she lives in Canada, Alberta, I believe. I'm going to let her give you a little bit of her background, and welcome. So welcome, Dr. Silverman.
Thank you very much. Thank you, Terry. Thank you for the opportunity and the honor. Hi, guys, and happy holidays to all of you. Happy and healthy and prosperous New Year. So I am a surgical pathologist. I am basically double-trained physician. I graduated as a pediatric surgeon in Russia and then immigrated to Canada, and then had to be retrained. I went back to school. I graduated from med school in the year 2000, completed a residency in anatomic pathology, absolutely by choice, and I'm loving it, and I practice surgical pathology with subspecialization. I subspecialize in breast pathology, and I diagnose a lot of cancers. Basically, that's why I have a passion. My passion is the health promotion. I believe that the best cure of the disease is the disease prevention. And I think as conventional physicians, we fail to treat the diseases. To cure the diseases. We may sort of maintain and treat the diseases, but ultimately we don't get to the bottom of it. And the bottom of it, I believe, is a healthy lifestyle. That's how I was introduced. I was introduced to Lifevantage and Pretendum after Christmas by Marisa Harrelson, Pro 5 now in Phoenix, Arizona, who is my closest friend, and started doing business, never thought of doing business, when Canada opened at the end of June. And we're trying to work up the team, and some of us are living the dream.
Love it.
So that's in a nutshell.
Tell me, when you have your day job, like many physicians, how do you make this work? And I guess another question would be why? Why do you try to make this work where there's so many excuses from so many people, and you have a full-time job? When I asked you prior, and I said, "Are you done with work?" And your words were, "It's never done."
I'm never done with work. I'm never done. This is a dream. This is a dream. Well, I'm an immigrant. And there are multiple levels to this dream. The dream is, first of all, I absolutely passionately believe in the power of Pretendum. To me, it's a no-brainer. To have simple, whole superfoods compacted in such a synergistic, basically homeopathic concentration, which eliminates side effect, and helping so many people. And not only helping so many people, I thought that this is such a no-brainer to put it in my body. If I have a chance to reduce my oxidative stress by 40% in 30 days, why would I deny my body the opportunity? That's how it started. I told you, I am food crazy. I'm a vegan for 8+ years. I basically consider every bite that comes to my body that it has a meaning. I eat superfoods. So being introduced to superfood Pretendum, as I said, was a no-brainer. And then on the way, when you take it, you talk about it. It's a given. When you talk about it, your friends want it. And your friends want it, and you're not colleagues because, conventional physician, it's a different breed. Not too many of us are open-minded, but lesser colleagues, lesser stature colleagues, not less important colleagues, they wanted to be on it, and then Why? I thought that if I would not do the business of Lifevantage, if I will not catch on this opportunity, I will kick myself in the butt. Pardon my language. Because every time we don't do, we think, I should have and I would have done it. But this time, not that I should have, I would have, I am doing it. I don't know how successful I am going to be. I don't know how successful my team is going to be, but we are doing it. And seeing people doing better, seeing multiple sclerosis patients doing better, seeing a hope in the eyes of ALS patient, diagnosing cancers and exercising my brain abilities doesn't cut it. And seeing my team members making few dollars and hopefully making even more, that is the joy. This warms up my heart and warms up my soul. So yes, our days are very long.
So you had called Protandim a superfood. And
yes, I would.
In your clinical expertise, why is this product so important, especially from somebody who looks at pathology every single day?
Well, that's why it is so important, because I look in the microscope and I diagnose cancers every day. I just diagnosed melanoma on a 35-year-old patient. If we can prevent, why won't we? Because oxidative stress is the core etiologic factor of major diseases as inflammation, neurodegeneration, cardiovascular diseases, and cancer. Why won't we if we have this? I believe that Nrf2 factor is the major gold healthy switch. And we have the best key.
You had mentioned Nrf2 when we talked on Saturday as well. How many physicians, conventional physicians, know about Nrf2? And on that same note, how many believe that it's very important?
Well, Terry, I'll tell you one thing. I had no clue that Nrf2 existed before January 2013. Meaning that I believe that the overwhelming majority of clinicians have no clue what Nrf2 is. However, some do, and they know that this is such a hot commodity. The more I talk about it, the more people start reading. My oncologists are aware of it now, actually via Protandim. Nobody talks about it. Some of my sort of colleagues, in a sense, are afraid because conventional physicians were close-minded. But when they started looking into science and started discovering Nrf2 factors and started talking with their biochemists and their PhDs, it's absolutely legit, and I think that the future of Nrf2 is outstanding. I think that one of the other varieties of Nrf2 are going to be on the table, like a salt and pepper shakers. It will be the next aspirin.
And as you think of Protandim as that one of those original Nrf2s, do you see this, and maybe a silly question because you do see this as an opportunity, how do you see Protandim in the light of Nrf2? Comparing, we've got the drugs and all those other things that are coming out. How do you see the light of Protandim in the future?
As a very bright light, as a comet. Awesome. Why won't you see it? It's I don't like the word natural because chickens that are treated with pesticides, herbicides, and antibiotics are also natural. But this is, I think this is the whole superfoods plant-based product. So how else can you explain it? What else do you anticipate from it?
And what do you have
when we think conventional drugs, the way we were taught in med school, every drug has two effects. One is a positive effect and the other one is a side effect. But here we're talking foods. Protandim is a superfood. So we are basically eliminating side effects. The side effect of Protandim is a cleansing. It's the best side effect anyone can want.
Well, I always say if something's got to come out, it'll come out of one hole or another, and you just got to be okay with that.
That's right, but that's what I'm saying. It's cleansing.
Yep, exactly.
When people start, Protandim doesn't agree with me. Oh, yes, it does. Protandim is doing the best thing for you. Yes, you're going to feel a little lousy, but that's exactly the best thing that happens to your body. You're detoxing, you're cleansing. And how can Protandim do that? Being in such low concentrations, it's a synergy. It's the beauty of the product.
So you're in Canada. One of my last questions for you is Canada ready for this? You're brand new there. You're basement floor. You're not even ground floor. You're in the basement in Canada as far as the opportunity here. What do you see happening? How can we help our Canadian distributors, those of us in the States? What can we do for you and our friends in Canada, and how do we approach them any differently?
I don't think you should approach us any differently. I think you should teach us the more and the more and the more and the merrier. I think the system that was established to succeed in the Lifevantage, it's a simple, efficient, excellent system that leads to success. I think we need to learn the pattern of duplication, and I think we need to learn the pattern of the blueprint, and I think we need to follow the master track. And I am the first one who's supposed to do that, and I'm going through my mistakes. I'm learning from my mistakes for not following the proper system. We just need to read the blueprint and just follow it step by step and not discovering anything new. Just grinding and, a teaching, a training, a tutorials, that's all we need consistently. And we also need not to be discouraged because it's a long process. All my team members, all of us, we have a full-time day job. My Filipino leg, they have 3-4 jobs. We all have to go through this uncomfort and disbalance. So I just don't know. I think if we believe in it, if we have our own whys, we just have to go for it.
But
my only problem is how can I convince my conventional colleagues?
Mm-hmm.
As of now, I don't know. That's a huge obstacle.
And it's hard for those because they're very good friends of ours, and it's difficult sometimes when you can't get them to look at things in a I don't know, I want to say bigger picture, but just even a different picture sometimes, that it's not always black and white.
Just an open-minded picture. Yeah. No, just tell. You cannot take it. Yeah. Why? They don't know why, but they just tell the patients, don't take it.
Well, again, what I love about this is we will and call your Canadian friends, right? I mean, let's get out there. Let's make those phone calls. Let's help Canada do more, because it's hard because you're out there all by yourself.
Yes, we are.
And, I think the other thing is that everyone should make sure they listen to the doctor calls. What do you think?
Oh, absolutely. We have such an incredible group. Thank you so very much. Every morning starts with emails and questions and answers and replies. You post and immediately somebody replies and gives you information and some hope and some references. We have an amazing group of people. It's extraordinarily helpful.
Well, you are a gem. I so appreciated talking to you this weekend and even more so tonight. I appreciate your time and your energy, and I know you've worked all day, and you are ready to go home and go to bed. So you go.
No, I'm not ready to go to bed. I want Pretendum. I have energy.
Well, you go. Enjoy your evening. Have a very Merry Christmas, and we will connect soon.
Thank you so very much, and all the best, and thank you for the opportunity. Let's stay healthy.
Absolutely. God bless.
Bye-bye.